Well, thank you, Chairman Tester, and to the ranking member as well. I was really proud to work with everyone here on a bipartisan basis to develop and pass the PACT Act into law. And it's already helped over 1,000 New Hampshire veterans enroll in VA healthcare and file more than 2,000 disability claims. So I'm excited by that progress, but obviously we have more progress to make. Dr. Elnahal, I want to start with a question to you. The VA's burn pits registry is one way for veterans to document their exposure to toxic substances and can help veterans access their VA disability benefits. But this online questionnaire is lengthy and can be hard for veterans to navigate on their own. Just one example, my staff recently met with Ed McCabe from Dover, New Hampshire. Ed is a 100% disabled combat veteran who served in Iraq and Afghanistan. He was exposed to burn pits at an air base in Iraq. Ed told us that he's had a hard time joining the burn pits registry because he ran into technical problems on the VA's website. I understand that the VA is actively working to overhaul the burn pits registry, but how are you going to ensure that the updates will be more user-friendly for veterans like Ed?
I think it's a very apt question, Senator. And the first thing I'll say, I just had a great visit to Manchester recently. I had a chance to meet the excellent team there who are really taking the PACT Act seriously, doing a lot of outreach events. We are very focused on making the registry much more user-friendly. In fact, we think that the work we're doing now will largely eliminate the need to do the over 100 questions on the website. We already have so many sources of information that can automatically populate the information needed in that registry. We intend to take every advantage of that. We'll be sharing more with this committee and with you and your staff once it's available.
Well, it really does make a huge difference, as you know, in terms of uptake, in terms of efficiency, and in terms of veterans actually getting registered. So I look forward to hearing more about that and working with you on it. Mr. Jacobs, I know that earlier you talked about the importance to you and to the VA of the veterans' experience as they're interacting with the VA and getting critical services. Many Granite State veterans have contacted my office because they have concerns about how far they've had to travel to get a medical exam for their VA disability claim. Recently, the VA Office of the Inspector General found that the VA wasn't adequately monitoring how far veterans were actually driving for their exams. So I appreciate the work that the VA has done to improve its oversight following that report, but I'm still concerned that veterans don't know what options they have when these appointments get scheduled. So, do I want one quicker, but I'm going to have to drive further? Do I want to stay closer to home and wait a little bit longer? So you've talked about how important the veterans' experience in interacting with the VA is. What are you doing to ensure that all veterans know the availability and timing of appointments that are close to home?
Well, Senator, thanks for raising that question. It's a concern that I share as well. We know that when a veteran goes to his or her CMP exam, it's often a pain point. There's this question of what is actually happening? Am I getting clinical care, or am I getting examined for a disability? Sometimes, to your point, it's too far away. Sometimes these are in locations that aren't sufficiently marked. So we're working with our vendors to make sure that there's clarity in terms of the process. There are steps veterans can take when they receive their examination notice and they feel that the timing in their location isn't appropriate, but we've got to do a better job of this, and that's exactly why we're working with the Veteran Experience Office.
Well, that's great, because this is really an important, I'm using the term customer service, but I don't think it really conveys how important it is, especially if you're somebody with a medical issue or disability. Long travel can be really difficult.
I'll add, the other thing that we're trying to do is we're trying to prevent unnecessary exams and overdevelopment. If we don't need a veteran to travel to an exam, we shouldn't do that, because that's time the veteran has to take off of work. They lose paid time off. Maybe they lose pay itself. We just don't want to do that unless it's necessary and beneficial for the veteran.
Okay. I'd look forward to hearing more about it and staying in touch about it. Last question, back to you, Dr. Elnahal. The Bipartisan PACT Act directed the VA to consider new research exploring how service members' health has been impacted by exposure to toxic substances. In your written testimony, you stated that the Veterans Health Administration is currently studying the impacts of PFAS exposure on veterans. These studies are really critical to New Hampshire veterans who were exposed to PFAS while serving at the former Pease Air Force Base. So can you tell me more about these studies and how the VA is collaborating with DoD and the National Guard Bureau in gathering the data?
Absolutely, Senator, on multiple fronts. So we do have an interagency working group that just met this month that is investigating this question alongside many other exposures and potential conditions associated with them. On top of that, we in particular collaborate with the components of Health and Human Services who are looking into PFAS,
Right.
which is a concerning substance, but we do not know, for example, what safe levels or quote unquote normal levels are and what the association is with specific diseases yet. And so that's science that needs to mature, but we of course are working with them and contributing to that so that we can then bring that knowledge to veteran care and better develop the research.
Thank you, and thank you, Mr. Chair.